Safety of Fluticasone plus Salmeterol in asthma. My name is Jenniffer Ochoa. I am from Catholic University, and here is my topic. Definition: Asthma is a chronic lung disease that inflames and narrows the airways. Asthma causes recurrent periods of wheezing, a whistling sound when you breathe, chest tightness, shortness of breath, and coughing. Fluticasone, a prescription corticosteroid used to prevent and reduce nasal inflammation. Salmeterol is a bronchodilator. It works by relaxing muscles in the airways to improve breathing.
Asthma is a chronic long-term condition that can be managed but not cured. Asthma affects the airways of your lungs. It causes the airways to narrow and swell, resulting in wheezing and difficulty breathing. During breathing or respiration, air goes in through our nose or mouth to the upper airways, at which point it reaches the windpipe, which branches into two large bronchi to reach the lungs. The lungs are protected by the rib cage, which also contains the muscles that control your breathing. In asthma, the airways are oversensitive and easily irritated by certain triggers, called asthmatic triggers. Most people with asthma are described as atopic, meaning they have an allergic type reaction to external triggers, such as house dust mites, pollen, cigarette smoke, animal fur, and chest infections. However, for some people, the onset of asthma is unpredictable and may be caused by anxiety, stress, or even laughter. An asthmatic trigger causes the airway walls to swell and the muscles around the airways to contract. The airways narrow, and breathing through them produces a whistling sound called wheezing. Mucus is produced from the lining of the airways, which clogs up the narrowed airways further and causes coughing. This makes normal breathing more difficult, producing symptoms of asthma that can be mild, moderate, or severe and life-threatening, where hospital treatment is needed. The narrowing of the airways is reversible if the trigger is removed, or if the inflammation is treated medically. Therefore, preventative treatment is used and can be managed by the patient themselves. An acute asthma attack requires medical intervention, but the type of intervention depends on the severity of the attack. For more information, visit www.nhs.uk.
Applications in medicine. Advil is used to prevent asthma attacks. It is also used to prevent flare-ups or worsening of chronic obstructive pulmonary disease (COPD) associated with chronic bronchitis and/or emphysema. Advil Discus is for use in adults and children who are at least 4 years old. Advil HFA is for use in adults and children who are at least 12 years old.
To run through how you use the discus, and then after that you can demonstrate back to me the correct use of it. It's a dry powder device and it contains 60 doses. There's a dose indicator on it that counts down from 60 to 0. The last 5 doses turn red. When it gets to 0, it means that it's empty, so you discard it and get a new device. To use it, you place it in one hand, and using your thumb from the other hand, push the thumb grip all the way over until you hear a click. Keep the mouthpiece upright and slide the lever down until you hear a click. Keeping it level, you breathe out to the side gently. Place the mouthpiece between your lips and take a deep breath and hold your breath for 10 seconds like so. And breathe out gently. When you're finished, you close the discus by pressing the thumb grip back towards you all the way until you hear a click. If you need to take a second puff, you just repeat the steps from the beginning. To clean it, you open it up, wipe the mouthpiece with a dry cloth or tissue on a daily basis, close it again, and store it below 30 degrees. Are you sure you understand that now, Killian? And you're ready to show me how to use it? That's great. Okay, we'll go ahead. So, okay with that? And I'll talk you through it, okay? So you hold it in one hand and using the thumb from your other hand, slide the thumb grip right around until you hear a click. That's it. Hold the mouthpiece upright and slide the lever down until you hear a click. That's it. Keeping it level, now breathe out gently to the side. It's very important that you don't breathe into the device. Okay, put the device to your lips and take a deep breath in and hold your breath for 10 seconds. Steady deep breath in. That's it, and hold for 10 seconds. 3, 4, 5, 6, 7, 8, 9, 10, and breathe out gently. Very good. Now you close the device by sliding the thumb grip all the way back towards you until you hear it click. Very good. Now if you need to take a second puff of the inhaler, you repeat the steps as we did from the beginning.
Pros and cons. Pros. Advert is used to prevent asthma attacks. Cons. Blurred vision, burning, tingling, numbness, or pain in the hands, arms, feet, or legs. Chills, cough, decreased vision, difficulty with breathing or swallowing, eye pain, fast heartbeat, fever, and headache.
Advair Diskus is the brand name for the combination of Fluticasone and Salmeterol, which is used to treat asthma and was approved by the FDA in 2000. When Fluticasone and Salmeterol are combined, they form a prescription drug which is available only under the brand name Advair Diskus. This medication is made up of a bronchodilator, Salmeterol, and a corticosteroid, Fluticasone. Like other bronchodilators, the salmeterol in Advair Diskus causes the muscle cells around a person's airways to relax, in turn opening them and making breathing easier. Meanwhile, the fluticasone component of this medication serves as a powerful anti-inflammatory in the airways, easing some of the long-term symptoms of the disease. Advair Diskus is most commonly used in the treatment of asthma. It can also be prescribed to treat bronchitis in people with chronic pulmonary obstructive disease. Advair Diskus is available to be inhaled in doses of 50 micrograms of salmeterol combined with 100, 250, or 500 micrograms of fluticasone. Advair Diskus is generally inhaled twice a day. Follow the picture instructions on the package and rinse your mouth with water after using this medication. The most commonly reported side effects of Advair Diskus include headaches and upper respiratory infections, but please ask your doctor for a complete list. Also, tell your doctor immediately if you experience swelling, a rash, an asthma attack that you can't treat with your short-acting medication, or any other significant changes. Advair Diskus should not be taken during an asthma attack, as it is for long-term asthma treatment only.
Ask your doctor for a full list of medications and conditions that should not be combined with Advair discus. Advair discus is commonly prescribed to treat asthma and bronchitis over the long term. However, this medication must always be used under the direct care of a physician. Please ask for and review all of the patient information provided by your doctor before taking Advair discus. The information in this video is intended to supplement, not substitute for, the prescribing instructions and the expertise of your physician. Always consult your doctor before using this drug.
Issue applied in Ecuador. Asthma has emerged as an important public health problem of urban populations in Latin America. Living in Ecuador may be source of asthma and allergies by increased exposure to UV rays. A cross-sectional study was conducted among 3,960 children aged 6 to 16 years living in Afro-Ecuadorian rural communities in Esmeraldas province in Ecuador. Allergic diseases and risk factors were assessed by questionnaire and allergic sensitization by allergen skin prick reactivity.
Advair discus, the brand name form of Fluticasone and Salmeterol, is a prescription medication used to treat asthma and chronic obstructive pulmonary disease. Advair contains two drugs, Fluticasone and Salmeterol. Fluticasone is a steroid medication which reduces inflammation in the airways. Salmeterol is a beta agonist which relaxes the muscles in the airways. These two drugs act to improve movement of air into the lungs. Advair discus comes as a dry powder for inhalation form and is usually taken twice a day. Common side effects of Advair discus are cold-like symptoms and headache. It's important not to take Advair unless prescribed by a doctor. For RxWiki, I'm Teresa Brucker.
Conclusion. Advair is a combination of fluticasone plus salmeterol. Fluticasone is the anti-inflammatory component of the combination, while salmeterol treats constriction of the airways. Together, they help prevent symptoms of coughing, wheezing, and shortness of breath. Don't use Advair to treat an asthma attack that has already begun. Salmeterol may increase the risk of asthma-related death. Use only the prescribed dose of Advair and don't use it for longer than your doctor recommends.
Today's episode of Know Your Drug, we were discussing Advair, which is a combination of fluconazole and salmeterol. Advair is commonly prescribed for the treatment of asthma and COPD, which is chronic obstructive pulmonary disease. It is a very common drug for the maintenance of these diseases. Today, we will be highlighting the importance of using Advair in the treatment of asthma and COPD.
Asthma is a chronic predisposition to the inflammation in the airway within the lungs known as the bronchi, so that they are extremely narrow. During an asthmatic attack, the airway becomes extremely constricted, as the smooth muscles in the bronchi constrict and block air from passing through, thus creating breathing trouble. COPD, or chronic obstructive pulmonary disease, is a simple condition to asthma. However, in COPD, the symptoms get progressively worse with the time and are far less reversible than in asthma.
The salmeterol portion of the drug is a member of the class of drugs known as beta-2 agonists, and the fluconazole portion of Advair is a member of the corticosteroids class of drugs. Corticosteroids work by blocking the allergic response to allergens, which aggravate asthma and COPD. The selective beta-2 agonist, the salmeterol, works on the smooth and voluntary muscle in the lungs. When salmeterol binds to the receptors in the lungs, the smooth muscle relaxes and allows airflow to occur more easily. Thus, the asthmatic symptoms would resolve.
Advair is commonly taken as one inhalation twice daily in order to ensure that the drug is constantly in your body working to prevent the symptoms of asthma or COPD. After each use, the patient should be sure to rinse out his or her mouth to prevent any kind of fungal infection from forming. Since Advair is an inhaled powder, Advair is available in 3 different strengths: 100 over 50, 250 over 50, 500 over 50. Only the 200 over 50 strength is indicated for the maintenance of COPD.
When first starting Advair, it is important to maintain your follow-up visits with your physician to ensure drug effectiveness without serious side effects. These visits may include pulmonary function tests, which measure the functional status of the lungs. Blood glucose levels and serum potassium levels are also monitored at these visits. While taking Advair, it is important to notify your healthcare professional immediately if your asthma symptoms worsen while taking Advair. This side effect presents itself as excessive wheezing, shortness of breath, or trouble breathing. Some lesser side effects include upper respiratory viral infections, the common cold, headache, sore throat, bronchitis, as well as nausea and vomiting.
If you miss a dose of this medication, take the dose as soon as you remember. If it is almost time for the next dose, skip the missed dose and wait until your next regularly scheduled dose. Do not use extra medication to make up the missed dose. Some potential drug interactions to be mindful of include some antidepressants known as MAOIs. Advair should not be used in conjunction with other long-acting beta agonists such as Foradil. Caution should be used while taking macrolide antibiotics such as clarithromycin and erythromycin. Notify your doctor or pharmacist of any prescription herbal or over-the-counter medication you take to ensure there are no serious interactions with your medications.
If used appropriately, Advair has been proven effective in treating the chronic symptoms of COPD and asthma. In addition to using Advair, patients should also avoid lifestyle habits that would make symptoms worse, such as smoking.
Always remember, pharmacists are the drug experts, utilizing them to ensure you are receiving the best pharmaceutical care possible and to know your drug.
On behalf of Phi Delta Chi and Duquesne University's Modern School of Pharmacy, my name is Matthew Gato.
And I'm Jake Messina, and this has been Know Your Drug.